I am Wyatt, and this is Caleb. We're going to talk to you about achondroplasia.
Okay, so achondroplasia is a disease, and the symptoms are, well, it causes dwarfism. And dwarfism is the abnormal shortening of the arms and legs. So you can see in this picture that the legs and the arms are not proportionate towards the body the way that it normally would be. The chest and the head are of normal size, though. And so,
Prognosis for this disease is that the children with it do not typically reach 5 feet, even going into adulthood. And if you have two heterozygous parents for it, you have a 25% chance that they will go homozygous for the disease and will most likely die within the first few months of life that way. So it's kind of hard to justify having children with this disease, and it's basically a lifelong illness.
okay, so there's no actual specific cure for achondroplasia. There are only treatments that can help with the pain and make it less bad. So growth hormones can help at a young age. If the child has achondroplasia, growth hormones can help them grow a little bit taller, but still they won't grow normal height. There are certain therapies that can make the pain slightly more bearable, like massages and therapies, like whirlpools. And so that basically means that they have to do that all the time, or they're just going to be in pain. So the final resort is if they're in pain all the time and it's because of the abnormal bone growth that is caused by achondroplasia, they have to have surgery. You can see in this picture the leg of a woman who had to have surgery to have some of the bone growth removed or made better.
The most common way to get achondroplasia is to actually have it mutated into you when you are developing in the womb. This is the FGFR3 gene that we will talk about later that is mutated, and that makes you heterozygous for it, which will give you the achondroplasia, which means that it can also be passed down genetically. So again, parents don't often justify having children this way. And 1 out of 15,000 births has this disease, and out of that 15,000, 1 out of 40,000 of those are live births. So again, very deadly and very rare.
Okay, so the mutation is caused in, or it happens in the FGFR3 gene. And basically what that gene does is it regulates cartilage growth. So that picture is cartilage. It's in between joints, and it helps things move and be so you can move around. And so if that doesn't grow properly, it grows overactively. The cartilage turns into bone. And so if that doesn't grow properly, the bone's not going to grow properly, which means that the bone growth is going to be overactive and cause it not to be normal bone length, and end up being below 5 feet, and the legs and arms being of abnormal length.
So here's our Punnett square. We crossed 2 heterozygous parents for it. Genotype, we have a 1 out of 4 chance that they will be completely fine, normal. That's good. Then we have a 50% chance that they will be heterozygous for it, so they might actually live through to adulthood with achondroplasia. And then we have the homozygous for it, and that's 1 out of 4 chance, and that pretty much guarantees death within the first few months. But most of these are still going to be very deadly without the percentages. And here's our sources.